Tonight, we talk about digging for gold. No, I'm not talking about the shiny stuff. I'm talking about boogers in your nose.
It doesn't feel as shook to dig your nose because you can't really feel it.
You can't feel it.
You can't get in there, is it?
No, you can get in there.
And what does an underbite have got to do with a narrow airway?
Because the teeth can't mate, it may affect her pronunciation. So it's a whole lot of things.
Find out more on
Let's Talk About Health. Good evening, everyone. Nose picking. I'm guilty of it. Are you?
Of course, I'm guilty of it, 100%. And I notice people tend to do that when they're driving as well. It's like,
Yeah.
you know.
You feel like you're in your own little bubble and
But
nobody can see you, but
guess
they're
what?
looking.
You're not. Everyone can see you. But
Yep.
hey, I want to know, is it good for you? Is it bad? What's really going on with this habit, right? So we're going to ask our guests whether they also are guilty of this. And we've got a professional joining us today as well. So why not welcome Yasminne, Benjamin, and Dr. Don Teo.
Hi, Dr. Don.
Thanks for having us.
It's almost a tongue twister. Dr. Don.
Hi there. Hey, you guys.
Yasminne, Ben.
Are you awesome? So you guys look great and glamorous, but what we're talking about is not so glamorous here today.
That's
It's about
right.
nose picking. Yeah.
Do you guys pick your nose?
Absolutely not. What are you talking about?
You know, the manicure really helps with the nose picking.
Actually, you know what? It doesn't.
What, it doesn't?
It doesn't. Ever since I've had gel nails, which
Yeah.
is about 15 years, it doesn't feel as shook to dig your nose because you can't really feel it.
You can't feel it.
You can't get in there, is it?
No,
It's
you
not
can
your-
get in there, but your nails have a bit of
A
tactileness.
separation kind of from
Yeah,
the
so
gel.
you don't feel it. It's like it's muted.
Oh, I'm so sorry to hear
And
that.
it could pass off, the
Here,
booger
come
could
here.
pass
I'll
off
do it
as
for
a little bit of your nail art. After that.
Oh, yes.
Yes.
I've got extra something there.
Ben, do you pick your nose?
I do it all the time.
All the time.
See, I told you this
no.
confession episode.
No, because I've got sinus problem, right? So when it's wet and then it gets hardened up, then what?
What do you do?
Yeah, what do you do, right?
Right.
Exactly.
Tissue.
Look there, guys, look there.
So the question is this bad for us?
Well, we should definitely not pick our noses.
Even with my tiny
Really?
finger?
No,
With the smallest finger? No.
No.
That's what nails are for.
Not the size of the finger that matters.
But you're cleaning it, right?
Unfortunately, no. So when we put our fingers in our noses, we're risking introducing infection into the nose. Secondly, it can cause abrasions and cuts. And, you know, the skin in our nose, called the mucosa, is really delicate. So if you pick it all the time, you
I
thin
have
it
been
down.
just battering it like for so long. I
I can
had
really
no
see up there.
Yeah, I really thought that she was going to say something like, oh, you know, look, we just want to try and avoid it. She said, absolutely not. I wasn't expecting that.
Wait, okay, so I'm curious, if this is not too personal of a question, how do you get rid of your boogers?
So there are various ways. Well, there are various ways. We could use nasal rinses or nasal sprays to soften it, moisturize the nasal cavity so that it comes
then
out
what?
easily.
And then it comes out easily with what?
When you blow your nose or when you sneeze. When you sneeze, you're actually expelling foreign objects
How
from
about
your
with the
nose.
tissue? So it's like more
Yeah.
gentle.
Okay, so like I mentioned, the skin in the nose called the mucosa is really delicate and thin. So if you keep rubbing at it or if you keep picking at it, the skin thins down, the blood vessels underneath get really exposed and close to the surface. This predisposes patients to nosebleeds. They get recurrent nosebleeds.
So,
It happens
yes.
more in the younger children because the mucosa is much
Delicate.
more delicate. So sometimes just the action of rubbing or putting a tissue in, when you rub it, it thins down the skin quite a bit.
So hold on, I got a burning question here. Like, what if you know that there's a giant booger in your
Yeah.
nose? Like, you know, it's there, it's stuck. Am I supposed to wait till I can get a nose rinse or something? Or just get in there and get it out now?
I say get in there and get it
Get
out.
in there, right? Like,
Yeah.
how can I live with it for another few hours?
Well, I guess you can do it, but gently.
Okay, so I have to be very delicate and gentle.
So tell us about congestion and and what we do to get rid of congestion.
Okay, so nasal congestion usually happens when there's swelling within the nose, in particular an area called the turbinate. The turbinate acts like fins in the nose. It directs the airflow, it humidifies it and warms it as it goes into the nasal cavity. But certain conditions can cause swelling of the turbinates. Commonly, it will be things like allergies or infections. Some people call it the morning nose or morning sinus.
Oh, that's me. That's my. Is that you too, Ben? Like,
yeah.
I have the morning sinus problem. Like, oh,
I
So
have
that-
the evening.
Well, that's called allergic rhinitis, essentially.
Different time
Wait,
zone.
is there evening sinus? Because I don't know if Mike is just...
No, I do. So at
do?
night it just starts to get.
Oh, so you're being
congested.
serious?
Oh, dead serious.
Oh,
Yeah.
okay.
I've been thinking so serious that I've been thinking about getting surgery for it. But I guess I should talk to a specialist first, right, and see if the problem is warranted.
Well, essentially, it's called allergic rhinitis. So the triggers are usually environmental. It would be things like most commonly dust, mold, animal dander. It can happen any time of the day, but sometimes, usually it happens after a trigger. So, for example, if you're in a bedroom with lots of stuffed toys and carpets and rugs, then obviously it tends to trigger. And when you wake up in the morning, you can come up with a really snotty nose, congested and runny nose, lots of sneezing and itch as well. Yeah, so that's what we call allergic rhinitis. So the other bit would be infections. A common cold that most of us would have experienced that before, and that causes swelling of the turbinates as well, and that can cause nasal congestion. If a patient would have allergic rhinitis, would be to avoid the triggers. That's the first thing, to avoid the exposures. But if it's persistent, then you should have a doctor see him to have him assessed. Medications can be started.
Yeah.
Yeah. Over-the-counter ones would be things like decongestants, nasal rinses, nasal flushes, antihistamines. But if it's persistent or recurrent, then medical help should be sought.
Okay.
Very, very quickly before we move on, I just want to know, is air conditioning a factor as well? Because I see you in aircon like all the time.
Air conditioning does sometimes cause that issue as well. Temperature change causes a problem. But more importantly, sometimes it could just be the filters. I mean, if you're collecting lots of dust, you're not servicing it well, you're getting all that trigger all night long.
And basically, yeah, that's why I wake up with a congested nose and I've been breathing through my mouth the whole night, which is another issue altogether.
I'll come over and change your filters, son.
Exactly. Oh, thank you, for free, right? So find out how mouth breathing could cause you health and dental issues as well. That's after the break.
Welcome back to Let's Talk About Health. Right now, we're going to tell you a story of how a young girl's nose was so clogged up, she was sick all the time. But thanks to her mother, that problem was solved. Here's their story.
I wasn't prepared. What am I going to say about this girl? She's really kind, also very clever, and I like the fact that she's got grit. She did a climb in Bhutan, and that was 6 hours up, and she did better than me. Sometimes she just amazes me.
Man, it was so boring waiting for you.
Really? Okay.
My name is Zara Chen. I am 9 years old. I like to do arts and crafts like sewing, and I also like cooking desserts with my mom.
Hi, my name is Linda Yan. I'm a mother of two. I'm also a dentist. When Zara was about 7 months old, I took her back to Australia to see all my dental friends. First thing they say is, oh, she's got class 3 tendency. She still looks really cute, however, she's got anterior crossbite, commonly known as an underbite. The issue with underbite is her lower jaw can actually keep on growing. It's not very efficient when you're chewing. So I do have patients, they can't chew the spaghetti off at all because the teeth can't meet. It may affect her pronunciation, so it's a whole lot of things.
As a dentist, Linda was able to correct her daughter's underbite over time. However, she began to suspect that the cause of Zara's underbite was not genetic.
When Zara's about 2 or 3 years old, she got sick quite a lot. I just assumed that because she's sick so often, she's always have a blocked nose and she just can't breathe through her nose. Then I noticed that she's always breathing through her mouth.
Mouth breathing does cause facial skeletal problems, as well as a whole variety of other dental problems. Often it would be things like a very long, narrow faces, what they call an adenoid faces. And when we look in the mouth, we do see sometimes a lot of crowding because of a very narrow palate and very arched palate as well. All these are generally signs that there may be something underlying that's going on that's making the child or the patient breathe from the mouth or rely on breathing from the mouth more often.
With the cause of Zara's mouth breathing revealed, Dr. Teo now had to determine how to solve it.
We then proceeded to go on with an examination with a camera called a nasal endoscope. What we found was that she had very narrow airways. And the airway starts from the front of the nose to the back. It goes down the throat into the big airway in the lung. So it's an L-shaped pipe, and we would want to assess both the front and the back of the nose as well as the throat. In Zara's case, she was blocked at all 3 levels. After discussion with Mummy, we decided to go ahead with a surgical procedure. So we dealt with all 3 areas of obstruction. From the front of the nose, where the turbinates were, we shrunk the turbinates. The adenoids, we reduced it, and the tonsils were removed. This allowed her to have a bigger airway.
It was actually meant to be quite invasive, but it was done very quickly. It was so easy, she didn't even register. One thing I do find is that after the surgery, she just doesn't get sick that much anymore. It's a big difference.
Now that Zara could breathe easier, Linda knows that the chances of Zara's underbite returning, as well as the habit of mouth breathing, are greatly reduced.
I'm glad I did something for her.
I appreciate Mommy for organizing stuff because she's really good at doing it. She also knows what my brother and I like, and she super good at playing with us, and she sometimes surprises us with super cool things. Happy Mother's Day!
She's so cute.
Thank you.
And right now, we welcome to the discussion Dr. Linda Yen.
Hello.
Hi.
Yes.
Well, that was a little glimpse into your own personal life.
That's right.
That was, your daughter is beautiful, by the way, and we're so
Thank
happy
you.
that the problem was solved.
So, what can you tell us more about this?
For a young child, if they've been a mouth breather throughout their whole life, you actually can see a few telltale signs, such as they can actually have dark circles, panda eyes. 7-year-old kid with panda eyes, it's just not normal. You can also see that they have this goldfish mouth, kind of prop it open a little bit like that.
Oh, okay, so she's
I don't see
actually
that in
demonstrating
either
that.
of you.
Yeah, horsey face, so the face is actually more narrow,
Okay.
because you don't have the tongue to see in the right place to actually make it nice and broad.
So-
Also, you get orangutan head posture. You can actually see people actually have a forward head posture like that.
That's me. I thought it was because of...
I do that sometimes, but I thought it was from excessive users of my phone.
If I start to notice these things in my 2-year-old, before we have to go through surgery or whatever it might be, medical procedure, what can I do?
Number one is you can actually try to figure out whether this is obstructive mouth breathing or is this a habitual, okay? So habitual mouth breathing means you've actually, all the passageway is actually patent. You just habitually try to breathe through the wrong side.
Wait, but why would somebody sort of breathe through the mouth through a habit, which is something that you need to...
Yeah, it's awful to breathe through the mouth at night. It's
and
not
it's
fun.
dry, and you have to sort of... Why would anybody do that, though?
And all the germs go into your mouth,
Yeah.
like you're eating it.
Exactly.
Yeah,
So-
Ben, did you have something to say?
Is that why I get thirsty all the time?
Yeah, so you
I
get
need to
dry
drink
mouth,
3,
yeah.
4 times at night.
Yes.
Yeah.
When you open your mouth,
Ben, you're a mouth
that's when you
breather,
get
aren't
that,
you?
yes.
So,
No, I thought because I don't breathe through the nose, then I would not snore, right?
So you can breathe through your nose at night if you wanted to.
I think I can. Like,
Chelsea, John, do you have anything to say?
I was just thinking that, yes.
Yeah.
Well, I think essentially, if you do see these signs, then the child should be checked out to make sure that there is no obvious obstruction.
He's not a child.
This child should be checked out. Okay, sorry. This child should be checked out right
Buy
now.
him masking tape
Patient should
for
be
Christmas.
checked out, yeah. It can be easily seen nowadays with video scopes. It's non-invasive, it's not painful, just a little uncomfortable, similar to a little swab. Yeah.
so I'll see you soon, Doc.
So you can't confirm that he is a mouth breather right now at this
we
point?
can.
or-
There are telltale signs, like Linda says, but sometimes those facial structural changes start when they start having the symptoms from a very young age. But when they start having the symptoms later, the bone has already formed, so you don't get that structural change.
Okay, so in other words, Ben will probably have to go through some testing at the clinic to figure out whether he truly is a mouth breather every night.
So if it's a persistent problem, then he should be checked out. It can be easily seen with a camera or a scope, just to have a look and to see if there's any obstruction and which levels of obstruction there
How do you break it if it's a habit?
If it's a habitual thing, which, say, for example, Dr. Dawn has checked the kid and the kid is fine, they should be able to breathe, and they can't breathe. Then what we do is I can actually teach them, I actually give them a whole series of exercise, which is myofunctional exercises. Wow. So basically help to retrain them, giving them breathing exercises, and also they will have an oral appliances such as a myo brace to help them to teach them how to strengthen their lip muscles so they can close their lips together.
A what brace?
Yeah.
So I realized when I'm too tired from late nights filming, right? You go home, you just sleep like that. Right?
Yeah.
So that's why, because we can't control the muscles there.
You know, Ben, this is like a free consultation for you
I
right
know
now on this
that.
couch. Do you have
Thank
any
you.
other? Do you have any further questions?
I've got one for Ben.
Yeah, okay.
Can you teach us a breathing method that would help?
Okay, so there are quite a few. A really easy way is, say, for example, belly breathing. So we actually...
belly breathing.
Yeah, so basically we get kids to learn to breathe through their belly. It's like when you're
Singing or
doing
whatever, right?
yoga or meditation.
Breathe from the belly, which
so
we don't
breathe
want to
through
do
your
because the
belly.
belly comes out.
Singing is with the diaphragm, not belly.
Isn't that the same thing?
No, diaphragm is like
Above
It is diaphragm.
Oh,
But
so it's the
we
diaphragm.
tell kids it's a belly because they don't know what diaphragm is.
Okay,
Say
I see.
diaphragm, they're right.
So that's actually what you do, and then we teach them to do it lying down, sitting, and standing. And later on, we also teach them little things like to increase their lip strength. Actually, it's very easy. You can actually put a business card, get them to hold the business card, and breathe through their nose.
Oh.
Okay.
Now, if
Just
they
clean it,
try
sterilize
to
it.
breathe through their mouth, the card will drop.
Here's my Amex.
Yes.
I wanted to know, like, what can parents at home do? Simple things to test if your kids are mouth breathing.
A simple way would be misting. So you get a spoon, put it when the child is sleeping, put it against the nose, just a little bit away from the nose and the mouth, and you can see misting if he's breathing from his nose or his mouth.
Okay.
Yeah.
Right.
That's
that
a
makes
simple
sense.
way of doing
All
that.
the parents,
Misting.
all the parents are going to get a spoon right now at night.
All right, well, thank you so much for joining us, Dr. Yem. We appreciate it. When we come back, we're going to find out how to clear out nasal congestion with Dr. Teo. We'll see you right after the break. So we've talked about why we shouldn't pick our noses. Now it's time to find out how we can clean our noses, because we've got to clean them, right, at some point. Let's start with the good old-fashioned way, tissue. Can you explain to these two fine people how to do this properly?
Yeah. Why don't you show me how
show
you
you
blow
how I
your
do it.
nose?
Okay, we'll both, huh?
Oh my God, he's blowing it right now.
Yeah, he's doing a real one.
He's doing it right
and
now.
he got it in there, just the standard.
Yeah, okay.
All right.
Yeah, I will go an extra mile with just, winding the tissue a little bit.
Yeah.
Like,
so you also protect your manicure.
Exactly. You
Yeah.
just kind of really get in there.
I've never seen that move.
Okay.
She's like, no.
Well, generally, the best way I find to get the snot out of the nose is to blow it at one at a time. So when you're blowing your right, just cover and blow gently, and then
And what do you
on
do with the
left as
tissue
well.
at that
Yeah,
point, though?
like
But
how?
when the snot comes out, you should just wipe it off. The tissue should never enter the nostril.
What?
Like
So basically, it comes out onto your face, then you wipe it off?
Wipe
just
it
on
off,
this
yeah.
bit, just wipe it on the outside. So like I mentioned, the skin or the mucosa in the skin's really, really delicate. So that's a definite no-no where you put the tissue in and
In other words, she doesn't
put it
care.
all
You know,
around.
yeah, I was just gonna say she did not respond to that at all. Like she's like,
Doctor,
no.
is there a chance, because we've been doing it so often, that the skin inside is like thick now, so it's like,
No,
I'll just do it now.
actually, it goes the other way around. The
Oh.
more you do that,
really?
you can cause abrasions.
Okay.
You can actually cause the skin to thin down some more.
Oh.
And then it can make you prone to nosebleeds.
Okay, so like, how about we just roll it up and just stick it in?
Oh,
Yeah.
okay.
You're not
Then you
supposed to stick anything into your
But
nose,
it's
apparently.
gentle.
Not in
There's
the
no
noses.
abrasion, right? You just stick it in and it kind of just like slowly, I don't know, soak it up.
Okay, that's also a no-no.
Oh.
Besides
I'd like to see
causing
that
abrasions,
at a dinner party.
I have seen bits of tissue left in the nose before.
This is all brand new information, but you know, naturally, there's something else sitting in front of Mike right now, and it's so natural to you holding this device.
So this is a nasal rinse. Some patients like to use it to wash their noses. It doesn't need to be used every day, but if you have a lot of thick mucus or boogers or just for nasal hygiene, you can use it. There are a variety of different types of nasal flushes on the market. This is just one of them. But essentially, it contains a little squeezy bottle. You fill it up with clean water. And usually the packet would consist of a powder, which is a salt and a bicarbonate powder, which you mix it up in that bottle. And you can use it. The best area to do it would be in the toilet.
Right.
In a shower.
Which we are in right now,
exactly.
obviously, so we're going to do that.
So this
Or in
could
front
be,
of a sink.
This could end up being very embarrassing. Is if I have a lot of boogers, they're all going to end up in this bowl.
Yes.
And you guys are all going to see it.
Well, that's fine. So first of all, this is a nasal rinse. It is not a jet flush. So go really gentle when you press it. You can see the water coming out.
So hold my breath, right?
Yeah, so it's like swimming. Take a deep breath.
Why am I nervous for this? Why? Like, why is this making me nervous?
Okay, take a deep breath. Stop breathing now.
Oh my God.
Yeah, so it's coming up from
Here we
the other side. You can tilt your head a little bit. Yeah. Okay. And
Continue. Finish the whole bottle.
Well, no,
Drink again.
don't do the whole bottle.
Another brother here.
We're going to face it, don't worry.
Why not the whole bottle?
Why'd you make me laugh? I'm wearing a nice suit. So I was expecting to feel, because she said you might feel the feeling of when you dive into a pool and it rushes up your nose. This was less than that.
Yeah.
It wasn't as
So you can control it.
traumatizing. Yeah.
Because you did it in a controlled manner. You
Yes.
didn't like.
Right up until you said that.
Sorry. You could try it by like going like that, and it would be a very, very different experience.
I don't see anything in the basin though, except
Yeah, no,
maybe your
that's not.
regrets from. Dr. Teo, thank you so much for joining us today. We really learned a lot, and guests, thank you so much for being spontaneous
Thank you for having us.
and almost doing the nasal rinse on national TV.
I'll tell you what, this has been a nose-opening experience for us. Thank you so much for watching. We'll see you next time on Let's Talk About Health.
Check out all of MediaCorp's digital platforms for more content in an exclusive online series called We Need to Talk About This.
Apparently, there are some health reasons for getting a circumcision.
The inner mucosa is actually the part of the foreskin that causes most problems. So most infections happen here, STIs get in from here. So if you leave it up to the doctor, we will want to remove as much of this inner mucosa as possible.
Okay.